Our next speaker is going to be talking about advanced CranioSacral Therapy. In fact, she's so advanced that she studied under John Upledger, and she worked on John Upledger. So please help me welcome. She's an RMT and a Reiki master and a CranioSacral Therapist, Hanne.
Thank you very much. You guys been here all day? Learning all you can about the body, or you're here specifically for CranioSacral? How many are here specifically for CranioSacral? Yeah, I'm sure I'm going to teach you a lot about CranioSacral. That's my calling. All right, so this talk was initially titled "What You Didn't Know About Your Body." So I was trying to figure out how to bring people in to really understand some things that they didn't understand before. So I hope that you will all learn something that you didn't know, not only about CranioSacral Therapy, but about how the body works. The first question probably a lot of you have on mind is, what is CranioSacral Therapy? And that's a rather difficult question to answer. It's sprung from cranial osteopathy. Dr. Upledger was an osteopath who about 30 years ago discovered a pulse from the production of cerebral spinal fluid. He was doing surgery, assisting on osteopathic surgery, removing a plaque from the back of the dura, the meninges that surrounds the brain and spinal cord of a client. And they were moving up and down. He was being asked to hold those membranes still, and he couldn't hold them still. And ever since then, he was very curious about what's going on, and one of the operating group saw this, but nobody knew what it was. So he did various studies and discovered that the cerebral spinal fluid that bathes and nourishes your central nervous system produces cerebral spinal fluid half the time and reabsorbs it the other half the time, so it creates a pulse in the system. And one of the things that's unique about CranioSacral Therapy is that it's working with a system that Western medicine doesn't generally acknowledge, and it would be as though they didn't acknowledge the respiratory system or the circulatory system, because it's a very important system that flushes and bathes and nourishes your central nervous system. So if that system were not cleansed and nourished, you would dirty the brain, right? We don't want that. The way that it works is with gentle manipulations in very specific ways. Four of the things that I've noticed that CranioSacral Therapy, how it works, is one is with mobilizing the bones of the skull, which is another thing that Western medicine doesn't know or believe in. We're taught, the anatomists teach, doctors in medical school, that the bones of the skull are fused in either childhood or adolescence, depending on which story we hear. But I move them for a living, I can tell you they move, and powerful things happen when they move. I've had people clear up migraines, headaches. I've had not one but two people blow nasal polyps out their nose. Sorry, kind of gross. But when they were thinking they were going to have surgery for that, because polyps can be a form of like a callus, like a bone spur. Your body has ways of buffering you from the things that happen to you. And if you can eliminate the restrictions or the friction within the system that's causing that to happen, the body is self-healing and self-regulating, and there's almost nothing that CranioSacral can't help you heal, because your body's doing its own healing. And in my mind, the bottom line is, it's all about the fascia. The fascia is a cellophane-like layer of connective tissue that surrounds every structure of your body, every muscle, every organ underneath all your skin. And it's supposed to glide, in general, against every surface that it touches, but when it gets restricted, then you have problems. We get older, we get stiffer, we get dysfunctions of organs. So back to the four ways that it works. With moving the bones of the skull, most of us have had falls, blows, surgeries to the head, sometimes in utero, sometimes in childhood that you don't even remember. And it really behooves everybody to try to get a CranioSacral session and see what might be holding you back that you're not even aware of. You'll feel that much better, and you didn't know there was anything wrong. The first day in training, the first thing they tell us is that your body is in a state of organized dysfunction, compensating for all the things that happen to you throughout your life. And the first thing that we do is disorganize you and give you new choices about how to be in your body. The second way that it works is with the cerebral spinal fluid. And just like the fascia can get stuck against muscles and other structures, so can the dura inside the skull and the spinal canal get stuck, other than its attachment sites, which are the cranium and the sacrum, which is what we call it, CranioSacral. And when that happens, as I said, you don't get proper flow of cerebral spinal fluid, and anything that has to do with the functioning of your nervous system can be impaired if the cervical spinal fluid is not flowing properly. So that's the second way that it works. We free up the dura inside the spinal column of the skull. The third way it works is with heat and energy and general manipulations through the fascia to restore the functionality of all your body parts. And I have a little visual aid here of Buckminster Fuller's tensegrity model. I don't know how many of you have heard of that or know about it, but this could represent your bones. This would be a pretty strange looking little organism, maybe a sea creature, I don't know. There's probably no bones here, but bones, and this would be the fascia, although it's a string. But fascia is made up of the grid of collagen and elastin fibers. So these could be some of the strings of the fascia. And this could be an organ inside being protected by the bones, and maybe the skin would be along the outside. If you, I don't know if you can see from here, but if you put pressures on the system or manipulate the system in any place, it has outcomes anywhere else in the system, and that's what's going on with you. So one of the reasons I want to give this talk is because when I do chair massage, and I masquerade as chair massage and CranioSacral Therapy. Shh, don't tell me. But one of the things that people tell me is that, well, I just have this 2 square inch area that hurts. Could you just work on that area? That's the answer? No, and that's because it's all connected. The whole system is interconnected. So I might work on your neck, and you say, wow, I feel that in my kidney, or I feel that in my left knee. That's really strange. Has anybody ever experienced that? Because it's all connected. And CranioSacral is not the only fabulous technique that can be used for all kinds of different things. But I think what differentiates it is that it's the fascia and it's the energy. Because when you're dealing with just bones, the muscles can pull the bones back out of alignment again. When you're dealing with just muscles, you feel a lot better afterwards, but what's happening is the nerve signals being calmed down. And it may or may not have anything to do with a healing result or removal of restrictions. It can, I'm not dissing massage therapy, I am a massage therapist, this principle. But I've done this work exclusively for 6 years. And I find that a muscle only knows, here's another thing you might not have known, a muscle only knows short or long. A contraction is a shortened muscle. So if someone is kneading on that muscle, but if it's held in place by the fascia, it becomes a brace for you, and you don't release that fascia, the muscle's going to feel better because you're resetting the nerve tone, but the fascia's still holding it in place, which is why you may feel the next day or a couple days later, I'm tense all over again, I hurt all over again. It's like Chinese food, goes in and out. CranioSacral Therapy is a fine, rich French meal that will last for a long time. I should mention that I'm a poster child for CranioSacral Therapy, and that my first treatment was in class. I studied it based on reputation alone, and I was cured of 30 years of chronic fatigue. That happened to me and I had to trace this back afterwards, like what was happening. I fell 6 feet onto concrete on my face when I was 9, and I jammed my sphenoid bone. And when we were doing the sphenoid releases, it's the bone that joins all the bones in the skull, all the other bones in the skull. When that was released, my pituitary kicked back into action. It was the pituitary is a traffic cop that tells all your endocrine systems underneath how to work. And it was like an elephant sat on the traffic cop for 30 years. And the elephant got up, and all of a sudden the traffic cop brushed himself off and said, okay, where was I? Okay, pituitary, you start doing your thing, let's have some energy. And it was remarkable. It took about 2 months for me to completely regain energy, and I had more energy, still do, now at 40 than I did since I was 10. So that was pretty exciting for me, and I became absolutely evangelistic about it. And I find that there's virtually nothing that can't be addressed with CranioSacral Therapy. Virtually nothing, because it's all about your body's ability to heal itself. It's all about your structure, because function follows structure. If all your structures are intact, the function will be intact. And I want to show you a little something. Well, first let me tell you, after finishing my advanced tube training with Dr. Upledger this last 2 weeks ago, I feel like floating on rainbows. I feel like this work is so beyond explanation. But a month or 2 prior to that, I had taken a study with the longtime top instructor of network chiropractic, and he is rebranded to massage therapist, and I've been trained in that. And the two work so awesomely together. I had training in other modalities, deep tissue and shiatsu and hot stone and 3 or 4 different things. But those were modalities. These are entire different disciplines. And I feel that although the method that they work doesn't overlap much, the results are like going in 2 different directions. So So I've been doing a lot of postural work lately, and I want to share this picture. Hopefully you can tell. This is taken last week. I gave this gentleman 3 sessions. This was his before session. This was his after the second week. That was after the 3rd week. So doing a lot of postural reconstruction because it's all about the structure. So what happens when his posture is better? One of the things that Dr. Wright taught me was that it's actually very, very bad for us to hunch over. And if you take a look around yourselves in the grocery store, everywhere you go, people naturally have sort of a hunch. You know, I mean, we're just not standing tall and proud anymore these days. And we know all the reasons behind that. You know, hunching over computers, being too sedentary, couch potatoitis, that sort of thing. But the nervous system, the spine doesn't really bend very much back. It only bends forward. So forward is flexion, which is putting a strain on the nervous system, on the spine. So it's not designed to be this way for a long time, and it takes time for it to recover when it comes back again. And the longer you do this, and the more often you do this, the more time it takes to recover. So you're actually slowly damaging the nervous system by hunching over. And so posture is more important than we think of in the reference. So maybe that's something we know today. What you know today. How many know what lymph is? Yay! Oh, I knew what lymph is. Lymph is the fluid between your cells, and it washes your system clean from the inside out. And it, according to what we were taught, correct me, 80% of your white blood cells are in your lymphatic system. You ask at the end, people are so they say 70% of your immunity is in your gut, and I don't know who believe them, but I don't believe in commercial people as well as I do my instructors. And that's a big part of your immunity. I also work with lymphatics. Anything that flows in your body is giving your body information about how to function properly. Anytime fascia is restricting the structures, you're losing your information, the flow of information. Blood flow is conducting nutrient information to all the cells of your body. Lymphatics is conducting immune flow, immune information flow to white blood cells. Cerebrospinal fluid is cleansing the nervous system. So it should be obvious how important flow is. And flow is also grace. Here's another thing. If you notice somebody walking up the street, you can probably tell from a distance what age they are by how they walk. You know what I'm saying? Because what do we start doing over time? We start being careful with how we walk or being efficient. So we know we only walk or move with the big muscles. And we're not doing a lot, some of us aren't doing a lot of yoga or a lot of dance or a lot of reaching and stretching. We're doing the same repetitive motions over and over again. And the body does more efficiently what it does more often. So when we are doing exercise movement that is reinforcing the strong muscles and not the weak muscles, that's what we become better at. And so we look like we're only moving with the big strong muscles. You start walking like that after a while. That's not how a young person walks. That's not how they move. When they move, I was working with that person with that picture and noticing how he was moving to reach up and get something. Where a young person, if they were reaching for something, they go into full extension. They use their whole bodies, and that's the difference. We become more careful because we're conserving energy, but in the end, we're using ourselves less, and that principle of use it or lose it is apt. So what's another thing? People don't know about the body. Referred pain, anybody heard of referred pain? So some people will say, well, I just work here. Could you just work here? Well, it could be it's starting over here. It could be it's starting from here. So, go out and educate the public. Go out and talk to everyone you know about what referred pain is. It's your body, I have noticed, has a subconscious just like your mind does. And it tells you what it wants you to know. And then people come in and argue with massage therapists and say, well, I know how my body works. And it's like saying, well, I know how my mind works. Well, if you've ever had a compulsion, if you've ever had a bad habit, you kind of could start to think about, well, maybe I'm not always the one driving the bus. Maybe there's this little 6-year-old in my subconscious that's driving the bus. So your body pretty much works the same way. It's all interconnected. There's a big mental connection, that mental emotional connection. CranioSacral Therapy does there's a triad of body influences on what governs our health and our wellness. And that is the biochemical, the structural, and the emotional. And in CranioSacral Therapy, we have a strong handle on the biochemical and the emotional. There's a component of the work, the energy part of it, and the fascial part of it, that allows for the release of emotional issues. And it's very, very powerful. I've had people come in and say, I'm just desperate and hopeless, can you help me? And of course I have to say, have you been to a therapist? And they say yes, and nothing's helped. And if we can find a group in the body, which we normally can because it's all connected, where does your mind stop and your body start? Where does your soul stop and your body start? It's all in there, it's all in the soup. Let's see. As an offshoot of osteopathy, and like most forms of alternative care, CranioSacral Therapy is based on causality. We care about how you get the way you are. And like that old joke that the doctor, the person goes to the doctor and says, "Doctor, it hurts when I do this." And the doctor says, "Well, stop doing this." The most important thing you can know about your health is if something's not working, be aware of your body. And CranioSacral ups your body awareness and gets your body to give you signals. And if you ignore the signals of your body, I'm hungry, I'm thirsty, I'm cold, I'm tired, you have a relationship with your body. And your body is there to serve you, but it's not real happy with you. So it's very important that you pay attention to the signals that you're getting, because those are outpourings of your life force, helping you to tell you what you need in your life. Even emotions are a compass to direct you which direction you need to go. We can get stuck in those emotions and say, I don't want, and your subconscious isn't registering the don't, and you're just programming. I've heard it said that worrying is praying for what you don't want, but that's a whole other side of things. But the emotional side is deeply, deeply connected. And they found that one of the differences between people who heal and people who don't from accidents has to do with the emotional environment at the time of the accident. Because we all know somebody who's had, a near fatal car crash, and 6 months later they're doing just fine. But we also know somebody who's had a little whiplash nerve 20 years ago and it's still like, oh, my aching head. And that could be the reason why. I wanted to talk a little bit about barriers to healing, because there's always going to be somebody who falls through the cracks who can't be helped. And if you ever get sick and you ever want to be well, I encourage you to check in with yourself about how much do you want to be well, and are there any barriers to healing, like payoffs for not being well. Like a lot of people get attention, they get intimacy, they get power, they don't have to exercise responsibility for getting well. Sometimes the interpersonal chemistry between client and therapist has something to do with the healing outcome. But I say again, in general, that CranioSacral Therapy can heal anything because your body can heal anything. And it's working with you and your inner wisdom of your body. What differentiates CranioSacral from other modalities is the fact that it's working with the fascia, it's working with cranial bones, and it's working with energy. And I was a Reiki master before I ever touched CranioSacral for the first time, and it's completely different. And I love Reiki. And there's a component of that dance between the fascia and the energy that is so powerful. Where I did deep tissue before I went into CranioSacral, and almost drew myself out of business. And found that I can go deeper with CranioSacral, not always with physical pressure, but I can get down to the bone. With this kind of work, it's the person's fascia around their bone that is holding them in this position. So by working with the fascia, you change the structure, this person's nervous system's going to be better. What's going to go along with his nervous system probably is energy, his attitude. I took a class right after massage school. It was very good about how your body shows up physically according to how you see the world and your role in it. And someone whose body is hunched over like this, what does that say about them when you see someone like this? Do you think, does it look like they feel good about themselves? Does it look like they're confident? Does it look like they're strong, happy, anything like that? No. And your body gets this message. Just because you're hunting over a computer or whatever, it doesn't mean that it's going to take out of 6 pieces. It sees this, it sees unhappy, low self-esteem, and it starts self-reinforcing. So it's very important to keep your body in motion. And I want to give you a couple of gifts of self-care that you can do for lymph and fascia. Anybody know the best self-care for your fascia? Yoga. It's very, very well-designed system of sequential releases of the fascia. I'm not going to say it's going to be for what CranioSacral does, but you can do fascia every day. You can do yoga every day. You can't do CranioSacral every day. You just won a lottery. The other thing is about lymph. I know so many people that are coming out with this and they got the sniffles, whatever. You can get one of those little rebounders, $20 at Walmart or more somewhere else. the old mini tramps. You just jump on those for a couple minutes a day, and it will kickstart your lymphatic system. So there's a shortcut for you for your health and well-being. A little freebie today. Stories. Let's see. Oh, I saw someone last month who had heart pains, and of course I have to ask him, have you been to see your doctor? I'm required to ask that. And he said yes, and they said my EKG was all over the map. And then I went to the hospital, and they did a whole battery test on me, and they said I was fine, it wasn't my heart, it wasn't a problem. But he had heart pains for 3 months, and they were ranging from like 2 to 7, and they never stopped completely. So he got a session with me, and not every session works, you know, I try to bundle them in a series of 3, so you try not, some people are a little slower than others because of that initial trust barrier in your body figuring out what it is that I'm asking you to do. But the first session, I saw him, and when he left, he was pain-free. A couple hours later, the pain had come back. But I said to him, I'd like you to come back because sometimes it does take a little while to work through the layers of what's going on in your body. So the pain came back a couple hours later. I asked him to please come back to see me one more time, at least, before I made up his mind. Then I didn't hear from him. And a week later, he emailed me and said, I want another appointment because 2 days after you worked on me, the pain's gone, it's been gone completely, and I just want to make sure it stays gone. And that was a great triumph for me. So the most fun thing for me is the wide range of things that people bring to me. And I'm at the point where I'm ready for anybody to bring me on. Bring it on, whatever it is. Because, you know, as your system sorts out this and that and the other thing, like I said, you start out in a state of organized dysfunction. And so you're like this. So a lot of times, once I make you like this, you're going to feel like this. Because you're used to being like this for so long, or whatever your dysfunction might be. But it's very interesting to be given that opportunity to get a fresh start within your own system. And after my recent training, I just feel like I'm in the soup, as I call it, because all my paradigms are up for reevaluation, and I feel much more conscious, and it was a lovely experience to get to work with 10 therapists, 2 teams. Each therapist was receiving 4 to 6 therapists on them for 2 hours a day, times 4 days. It was very exciting stuff. So, I'm not seeing the time thing here, but okay. So, 3 more stories, and then I'll ask for questions. I had a schizophrenic who, of course, I tried to refer her to a psychotherapist, but she wouldn't go because she thought they were all evil and or she's paranoid and delusional. And within 6 months, she stopped having delusions. And I went to some of my top instructors and they said, run, don't walk, don't even try to treat this. But I knew she didn't have anywhere else to go, and she was getting physical benefits from body work. I've had at least 3 clients that come to me regularly that after about 6 months their hair color should have from mostly salt to mostly pepper. They're, all kinds of physiological changes, blood pressure, blood sugar. It's all about your system, and your system is self-regulating when you remove the barriers and the restrictions that get it confused. It's just a matter of overwhelm. And the biochemical, the toxin end of things, that's somewhat different, but I also often feel when I'm detoxifying people from drugs, and I can often tell when a drug is coming out of them because I feel as though I'm taking the drug. You know, anesthesia, barium, hormones, blood pressure medication. I remember one woman saying, I asked her, I feel a drug coming out of you, are you on any medications? And she said, no. And I said, it feels like it's something for like regulation. And she said, oh, blood pressure medication, yeah, I'm on that. Well, that would be one. Right? So it's kind of interesting to be on the receiving end of things. So that's why it's so hard to describe CranioSacral Therapy, because it does so many different things. And I do have a little coupon here if you for 10% off if you book 3 sessions. And do I have any questions? Yes?
Could you redefine sacrum or sacral?
The sacrum is at the base of your spine, right above the coccyx, the tailbone. It's a little triangle-shaped bone. Anybody else?
So this is basically just a more intense form of massage.
Because because it's energy work, it's done under my massage license, but I'm glad you asked that question because I know one of my best CranioSacral friends is a physical therapist, and it's all she does. She doesn't do anything. She learned a physical therapist because it's more powerful than that. We know a colleague who has a PhD in psychotherapy, and he went back to massage school to get a license to touch so that he could do this because it was probably more effective than psychotherapy, but it certainly gave him major tools that he didn't have just with talk therapy because it's connected, and he's smart enough to know that. Body, mind, spirit, it's all connected. So I do have a massage license, but there are osteopaths, doctors, chiropractors that do it as well. So it is soft tissue work, and that's why I'm allowed to do it with my massage license. Anybody else? Yeah.
Can you help people who have fluid around the heart and large heart, things like that, with this type of treatment?
I can never promise to help anybody, but
It would be a challenge, I promise you.
I love challenges. My track record is very, very good. Probably 80% of people come in, get whatever it is they're looking for.
It is my mother, and she's been listening to doctors ever since I know her. That's Sheryl with her health. I really asked her yesterday too.
Most of what they do in the medical field is drugs and surgery, and that's good for what it's good for, but it's not looking at the causality. And sometimes if you clear up a problem, you get the same problem again. You treat it that way.
I think you said a little while ago about having to go back to something that happened to them,
Right?
an injury or something.
Right?
I'm thinking that I know that there has to have been something in her childhood that probably created all the illnesses that she has experienced in her life.
Right. And the degree of healing you get is commensurate with the degree of openness you have to being healed and readiness to being healed. All right, so I'm over in the outside booth, like 2/3 of the way down the window. So I hope you'll all come see me and get a session at 20 minutes for $20. And I've got brochures down here and business cards and little coupons. And thank you very much for coming today.